Hello, viewers. Today we have with us Ms. Neha Sinha. She is the CEO and co founder of Epoch Elder Care and a dementia specialist, a clinical psychologist, and who's trained in palliative care. And she founded Epoch in 2012 to give support to elderly, especially those with dementia, so that they can live life with dignity. Welcome, Neha.
Thank you, Rajkumari. Thank you so much for
Thank
having me here.
Yeah, thank you for being with us. So, I'll begin in the very beginning. Tell me, how did you enter this field, elderly care and dementia? It's a very heavy field, and not many people, normally, people towards their middle of the career or end of the career would enter into such fields. You began with it.
Yeah, yeah. I think to be honest, it was a chance entering into the field. So I've been brought up by my grandparents in a small town called Raukela. So and my mom was a single mom and she was very busy sort of doing her PhD while I grew up. So most of my time, so for me, my parents were my grandparents. So from childhood into, well into adulthood, I think I was very comfortable spending time around elders, around their friends. I remember going, with them to their parties and social gatherings and so on. And I had this natural affinity to connect. But later on, I studied, I became a psychologist, practice, etc. And then, I sort of met Kabir, who's the founder, and we thought that, let's do something in this space simply because, I'll tell you a very simple thing that with elders, it's very easy to make an impact. And what that means is that, you will have to put in a little bit of effort and you will see the difference that it makes in their life. And that, I think, that gratification is just priceless for everyone who I've worked with in the last 10 years. Um, whether it is spending time, like everyone says, loneliness is, the age old thing, but not only just spending time, but just understanding a little bit about what they want can make a huge impact in the quality of life they lead. And I think just that's something wonderful. That's not something that you can get in any other field, to be honest.
But dementia is a very heavy thing, and I know you are a psychologist, but it can play heavily on your mind, no? It
Well,
can
it
play.
depends on how you see it. It is a tough condition to manage, no doubt about it. But
Yeah.
how I like to put it is, it's like when someone has dementia, and loss of language is a very significant part of their condition. So how I like to put it is, it's just that they start communicating in a different language, and all we have to
Okay.
do is learn that language. And if you learn
Okay.
that language, then it's I wouldn't say it's easy, but you will be able to help them. So yes,
Uh,
it's challenging and the burnout is immense. But this training is not that you have to do like an immense training, put in 2 years to learn something. No, you just need the right amount of understanding. And yes, the impact and the change that you'll be able to bring is significant.
Maybe the right amount of empathy.
So right amount of empathy, love, and patience is something. If you don't have these three things, it's very difficult to be a caregiver. And I say this very often, that being in the elder care segment, irrespective of what your profile is, you may be in finance, you may be in marketing also, but in your heart you need to understand who a caregiver is. So, and to be a caregiver, you need to put someone else's need, ahead
Before
of
you.
your need.
Yeah.
Yeah. And that's
True.
essentially a nutshell of. So, there are only a kind of people who can sustain in this field. Not
Huh.
everyone is cut out like that. And especially you mentioned palliative care also. So, palliative
Yeah.
care is end of life care, right? So to be able to in a way, like how I say it, like add colors in their lives in the last few years of their life, when you're able to
Yeah.
really make it colorful and joyful in spite of whatever condition they have. That is what essentially is the crux of what we do.
Okay. Okay. So tell us about Epoch Elder Homes. Like, how many are there? Where all they are there, and how do you function exactly?
Yeah,
How
sure.
many?
So we have Epoch Elder Care homes. So we call it Epoch Assisted Living, basically. So we have
Okay.
assisted living dementia care homes, essentially
Hmm.
for elders who need help with their activities of daily livings, which is ADLs. So all
Hmm.
elders need assistance with their daily lives, or who have chronic conditions,
Hmm.
medical conditions, who have nursing needs, let's say post-operative care. So
Hmm.
essentially, elders who are in a long-term state where they need close care and monitoring are the profile of elders who we care for. So our average age of elders would be 80 to 85. So we have three
Oh,
homes right now. Yes,
okay.
two in Gurgaon and one in Pune.
Huh.
And these are small homes. So the idea when we, kind of some of the design principles of our homes was that we don't want them to be large institutional like homes, because there's a lot of stigma about, sending a parent away to a home.
I know.
And right, so the moment you have a large 50, 60 room unit, you think of it like a hospital or a hostel.
Hmm. Hostel.
And yeah, so
Hmm.
that's one thing which we are very clear about, that ye ghar wala feel lana is very important. The care is
Hmm.
important, but also the infra, the design, the environment of the house is very important. So we try to, so basically the work we do may be very clinical in nature, very deep, what do you say, critical care can be one of the elements, but the environment that we create inside these homes is very ghar like. So it's not a
Okay.
hotel, it's not a hospital, it's a home.
Uh, uh. So how many people are there? See, in Gurgaon, two homes in Gurgaon and one in Pune. How
Yeah,
many people are there individually in each of these homes?
yeah. So we
And
have
what's the total capacity also?
So our capacity is around 50 elders,
Okay.
and right now we have about 44 elders.
Okay.
And individually, so we have the three homes are three different formats. So one is two apartments together, one is a villa, one is an
Acha.
apartment. So
Okay.
we are in a way agnostic to the format of infra. But so Pune, for example, is a small unit. In fact, we just sort of moving out to a larger one. So there we have about eight elders, and in
Okay.
Gurgaon homes, one we have about 12, one we have about 22.
Hmm. So you have any couples also? Do couples come or they are like individual
Yeah,
in
so they do, but they are. So we profile our couple so that the couple is also able to lead that kind of life that they want, right?
Hmm.
If both of them have care requirements, then they are an
Hmm.
ideal fit. But if
Hmm.
one of them is an independent elder and wants to lead a social life and so on, then we advise that if there is alternative solution that we can come up, maybe
Okay.
they can come spend time. But yes, we have had couples, we have one couple with us currently right now,
Okay.
so yeah.
Okay. Okay. And these people, which section of the society do you actually cater to? Is it upper rich?
So I wouldn't want to label that as a particular section of the society.
Hmm.
But see, good care, or the kind of care that we do comes at a price. So
Hmm.
things about our starting price is at about 87,000. For a
Hmm.
two sharing room, and this includes everything, all the care, all the nursing care, including food, nutrition, etc., activities, engagement.
Hmm.
So it comes at a price, and if you look at it, if you have a condition, let's say you're paralyzed, you have a stroke, and you have a nurse, you have a rise tube, and you need someone to be monitoring you every hour and so on, then the setup that you do at home will end up costing as much. In
Yeah.
addition to it, you have to not only supervise the nurse, make sure the arrangements, the doctor management, managing every other thing, like how you say it takes a child to bring up a village is the same for an elder. So it's not that
Hmm.
you just take them to a hospital and give them the why, it's the end of
Hmm.
it. You need
Hmm.
to do a
Hmm.
bunch of things. So right now, by default, we have a lot of NRI and HNI,
Okay.
families whose parents are with us. But having said that, it's not that this is the only profile that we cater to. We do recognize that care can be more affordable, and that's absolutely what the plan is.
Okay. You will be working towards that.
Definitely, and scale, growth and scale will be a huge
Hmm.
element to help us achieve that, and that's absolutely what we want to do be across the country, in all cities as much as possible and make it more affordable. Yes.
Okay, okay. And how do the elderly come to you? What is the it's through advertisements, or I don't know, how do they come? How do they approach you? How do they
Yeah.
know that you are there?
Sure. So actually, we have, in a way, so we've been around for the last, decade.
10
So it's been
years.
10 years that we've been here, and we were one of the very few first movers in the industry, very few players who started off, even when we started off with the assisted living homes in 2014. So we have had a lot of our elders or families approach us through referrals, because there has been word of mouth, thankfully,
Okay.
touch wood, because of the work we have done. Having said that, of course, it's a competitive space right now. And the usual tools of having a digital presence also kind of plays a key role, and also working through doctors, clinical networks, etc. But families typically approach us. It's not the elders and their children
Acha.
approach us. But it's not a very straightforward thing that they see an advert and they come to you and they convert. It's a lot of counseling, hand holding, managing their guilt, helping them understand why it is the right decision for us, for a conversion to happen, to be honest.
So after the elderly come to you, do the children or the other family members they come and meet?
Oh yes, oh yes. In fact, contrary to perception that यहाँ पे they are left, they leave their parents away. It's actually not like that. In the experience that we have had, families are very involved. In fact, I would say very over involved. And we also have a style of working where the care plans that we make are collaborative. So we
Okay.
require or we request the families to be with us. So we send a daily update, a weekly update. We tell them to be with us on a call on a quarterly basis, so that we can plan. Ki next quarter, mein, this is what the care plan looks like. These are the
Okay.
changes we make. And to be honest, it's also home for families. That's one
Hmm.
of the things that we want to communicate. This is also your home. So we have an open door policy, So that means that families can walk in anytime. आप आइए,
Okay.
spend time over here, have घर का खाना, participate in our functions. So we have
Okay.
whatever Holi, Diwali,
Hmm.
Janmashtami, families drop in, take part in the puja, everything. So we have a lot of family participation.
There are no fixed days like mostly old age homes. They have some fixed days when you can go and meet them.
Nay. So that's exactly what the idea is. Ki, this is not a the structure is only there for sort of efficiency and better care, but there's no hard and fast schedule. Ki isi time pe ye hona hai, isi time pe you can come. It all depends on what the elders are comfortable with. So if they are not they're available, they want to meet. We're very happy to have visitors, volunteers, all of that.
Hmm. And elderly people are happy with their peer groups. Normally, what I feel is, what my perception is, that they would be more happy at their homes with their own children, with their own grandkids. What do you say to that?
Yeah, I agree. I agree with you 100%. No one can substitute your own home, and your family. I've been a very strong believer of that. But having said that, what happens when your family is just not there? So that when you look at the other angle, that just because that's the right thing to do, but are we really able to deliver that? So if an elder is cooped up in a room with no interaction, and interaction is a very key part, right? So interaction is not just one meal a day, or meeting on weekends. It's you need the mind to be constantly stimulated. So cognitive stimulation and social interaction, these two are very important elements of aging healthy. And that in the current setup, and we are all guilty of it, that how much time do we really spend at home, and especially when the elder requires close care, they require their motivation. Sometimes it takes 2 hours to feed someone. Sometimes it takes a lot of motivation to encourage them to come out, take a bath, and play a game with you, or watch a video with you. So these things are time and effort based, and unfortunately, families are just not able to do it. That's the current lifestyle that we are all a part of. So hence, there has to be a solution. You can't just leave them alone.
What all health issues, apart from dementia, what all health issues do the elderly at these homes have? And more importantly, how do you take care of those?
Sure.
Because there are specific issues, different elders would need different kind of care.
Yeah, 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 absolutely. So the whole spectrum of neurological conditions, so which is apart from dementia, would be anything to do with post-stroke complications, Parkinson's, multiple sclerosis, progressive palsy, PSP. So there's a whole segment of neuro disorders. But apart from that, all chronic conditions. Let's say you have a heart condition, you have a lung condition, any condition which essentially requires long term care are formats that we kind of cater to. Then short term care would be any kind of post operative care. So you
Acha,
had
that
a
also you provide.
Yes, so you have a hip replacement, you have a knee replacement, you've undergone any kind of a, let's say, a heart surgery, and you basically need a structured environment to recuperate. And again, like I'm saying, recuperation is not just giving medication and taking them to the hospital. It is many things. It's about keeping their spirit alive.
Yeah,
And,
I think it's more about emotional well-being.
Very much. Yes, yes. So emotional support and social support, any kind of terminal illness, if somebody's had a terminal diagnosis and you have whatever, last couple of months, even weeks. So that is the time where you come in, and the so how we care for is every home is run by a nursing team, and we have specialists on board. We have a doctor on board, we have a geriatrician on board, and so on. So that's the whole clinical and medical aspect to it. But that's just one aspect. So of course there is a streamlined process. We do assessments. We ensure that every care plan that we create has an outcome to it. So every care plan that we, like I said, we do quarterly calls. So every 3 months we evaluate that what is the outcome or what is the care goal that we want to achieve with the elderly. For someone it would be we want to put on weight, or for someone we would say that this person needs to start walking a little more independently. We increase something called functionality, which means that you're independent, you're able to wear your clothes, you're able to brush your teeth, you're able to comb your hair, because these things matter to elders a lot, right? कि
Yeah,
आप
yeah.
कितने independent हो. So care essentially is a combination of these things. So medical care, functionality, mobility, social engagement, emotional engagement, nutrition and hydration, and all of that. So just to summarize, our focus is on the person as much as the clinical condition. And what that means is, there's a term called person-centered care. So इसका मतलब होता है that care is tailored for every person. So what care you need and what care I need cannot be the same. And it depends
Yeah.
on who I am as a person, which means ki my personal history and my current skill set. So we combine these two, and we make sure that the elder is able to be a decision maker in their care plan.
Okay.
So that's an important part.
Any difficult situations you have had? Any something which is extraordinarily challenging? I know each of the cases must be challenging in a big challenge in itself, but are there any cases which have been like more difficult to handle?
Yeah, of course. I think so. 70% of our elders have dementia.
Uh,
So that is one segment of challenges simply because of how the condition is. And, like I was saying, so the ability to communicate for someone with dementia kind of goes away as the stage progresses, and it's a progressive condition. So when the moment, you have a barrier where the person is not able to communicate what they need, that becomes a very big challenge. So let's say they want to go home. Going home is a very common thing, and they say हमें घर जाना है अपने घर में रह के भी. Even in their own home they say we want to go home, because going home is a state of mind. It's not that yes, that means going home. It means that they're anxious, or it means that they are uncomfortable, or their idea of home maybe their bachpan ka ghar, because there's memory loss, and you kind of forget short term memory, kind of lose short term memory very quickly. So difficulties in managing challenging behaviors, anxiety, agitation without the use of medication is essentially a challenge that we face very frequently, and it, like you said in the beginning, it requires a different level of empathy to
Hmm.
understand that if somebody is asking you the same question 20 times कि मुझे
Hmm.
खाना नहीं मिला है, मुझे खाना नहीं मिला है, तो आप इसका जवाब
Hmm.
कैसे दे सकते हैं? And if somebody is getting
Hmm.
angry on you, how can you still be
Hmm.
patient? So this is one segment, and the other segment is, to be honest, elders who are cognitively aware, who are fine,
Hmm.
but
Hmm.
they, you have to put in a lot of effort to make them feel that this is their home, because just saying कि आपका घर है is not enough.
Hmm.
How do you make it their home? उनको यहाँ पे how do you in a way sort of not
Hmm.
substitute but at least play some role of their family,
Hmm.
is a challenge, is definitely a challenge, because in the
Hmm.
cultural context of India and even Asia for that matter, leaving
Hmm.
your own home, moving into a care home or even a beautiful retirement community is not a normal thing.
Not a
So
normal thing, yeah.
yeah, so usme I think it happens. It's not that we have seen elders fall in love and say यही मेरा घर है और मुझे अपने घर जाना नहीं है. That has also happened, but it takes a
Okay.
lot of it. Yeah.
So, are there any, like you talked about the short term people who come for a short term, like
Mhm.
heart patients or people who have had surgery, hip surgery, and all that? So, how many numbers are there? Like, of all the thing, how many would they be if you
So
take
about
numbers?
5%, about
Acha.
5%. Yeah,
Uh,
and the idea
become
is
they become all right and then they leave. That's it,
yes.
na?
Yes, yes.
Huh?
So we do typically they move in our world, short term stay would be about 2 to 3 months. It's not that they're coming here for a few days. We are open to
Huh.
that also. But
Huh.
ideally,
Huh.
a good recuperation takes that much time.
That's
So,
true.
and that's one of the verticals that we want to build also from now on, because we've
Okay.
had a lot of elders who have automatically, come to us. But now I think that's a very important part where, you're not ready to move into a home, but still you need the care. And, as we grow and expand and we have more availability of rooms, we'll be very
Hmm.
happy to, take that up.
Yeah. And how do you through the day? How do you keep them occupied? What kind of activities do you do? Neha was telling me that you have some bakery classes or something.
Yeah, yeah, yeah. So I'm glad you asked this. So keeping them engaged and with purpose is a very important, philosophy of care that we have. And why I say purpose is that, it's not just you just play Ludo or you just play a game, carrot,
Hmm.
it's not that. Because after a point, they'll be like, why am I doing this? We don't want to do childlike things. So,
Hmm.
so we have a very streamlined, in a way, routine of the day. So the day is planned. There are timings, etc. If
Hmm.
somebody doesn't want to, kind of doesn't want to eat right now, want to eat later, doesn't want to take a bath right now, all of that is pretty flexible depending on the elders' preferences. So it's not the
Okay.
nobaji hama and things like that. But activities, we try and motivate them to come out of the rooms at a particular time. So twice a day we have group activities,
Hmm.
and we have all kinds. So we have about 5 6 categories of activities. So
Hmm.
one would be, to do with cognitive stimulation. So you're doing like puzzles and, math games or quizzes and so on, playing a sudoku, and things like that, or engaging
Crosswords.
in crosswords or engaging in an intellectual conversation and
Hmm.
so on. So that's the cognitive part. Then we have motor sensory activities, to
Hmm.
use, to keep your hands, hands and all your motor abilities, to keep them intact for as long as possible. And then we have
Hmm.
eye-hand coordination, and then we have sensory stimulation. So using, like smells and touch and feel and things like that. So
Hmm.
apart from this, we have we use a lot of music and dance, because that's something which, automatically people engage in. So, just
Hmm.
yesterday evening, we had this, live music. So we have karaoke. So the mic is passed around and there's singing. There are bhajan sessions, etc. There are movie nights. So all any, social gathering में बैठ के whatever you would want to do. So those are big parts. We do a lot of celebrations. So every single festival in India, we
Hmm.
make sure that जैसे घर में आप तैयारी करते थे, you would make
Hmm.
preparation, etc. So
Hmm.
Janmashtami हुआ, we made the jhula, we made the mithai, we did the puja. So every
Hmm.
house has their own individual
Kitchen.
celebrations. And the last is like kitchen. So
Hmm.
once a week we have food related. So everyone sits in the dining room, so eat, so non fire, कुछ बेक किया कुछ बनाया. So there are lot of creative things that we do. So laddu making हो गया, or we use food
अच्छा.
to make art and craft, or we actually you can use food. Food is very flexible. So let's say there's chole and rajma and you separate grains, so that's like a
Okay.
concentration activity. Then
Hmm.
you're assembling a fruit chart together, you're making a cocktail together. So
Hmm.
that's you're thinking, you're using a little bit of judgment, and purely
Hmm.
for fun we use, today we have all made, all the mithais and the celebration things are actually made with the elders. So
Okay.
the care team, the kitchen team and elders sit together and they make it
Hmm.
in house. So that's
Okay.
one of the things which they really enjoy. In fact, we have some elders who want to also go to the kitchen and make. हम वो भी encourage
Uh,
करते हैं. So
because
whether
kitchen is an important part, no, of anybody's life,
yes, yes,
especially women. They feel very out of place if they are not in the kitchen, right?
totally, absolutely agree.
Uh,
So we
uh,
absolutely have to take that into account. So there are some,
mm,
this one auntie who loves to make biryani. So we
mm,
encourage them, share your recipe if you have, you remember
mm,
them, you want to do them. So we make them feel involved. कि You go and instruct the team. खुद भी
mm,
बनाते हैं. We help them with the chopping and all. So
mm,
that's the advantage of being in a small house. So it's really
mm,
घर वाला setting. So आप जाके वो कर
mm,
सकते हो. So that is it.
mm,
And lastly, we also take them out. So
mm.
outings is also a very important part
Okay.
of social engagement,
Uh-huh.
because the idea is to कि आप इनके in their current clinical condition, how normal can their lives be. So we believe in a concept called normalizing lives, which
Mm,
means that yes, you have ABCDE
mm,
comorbidities and your
mm,
mobility is restricted and you're on a wheelchair, but can I
mm,
still go to a PVR and watch a movie?
mm.
We make that
So
happen.
where
Going out. So we do that, and we also do between our homes भी visits कराते हैं. So we have two
okay.
homes in Gurgaon. So इस घर से वहाँ चले गए lunch करने,
Mm,
things like that. So
mm,
change of environment sort of helps a
mm,
lot.
mm. And how much of high-end technology do you use? Uh, Whether it is managing the elders or connecting with their families, how do you go
Yeah.
about it?
So
How does
technology.
it help?
Yeah, so in our age profile of elders, which is about 80 to 85, technology is they are not the end users of technology. So they are
Mm,
not the ones using an app or
mm,
using a software and so on. But it
mm,
is used to build in efficiencies in our case. So for example, our
mm,
documentation all happens on a nursing software.
mm,
Then we are actually doing running a pilot on using sensors in our homes. So how do you use sensors to create an alarm if an elder gets up from their beds and so on. Then of course the whole world of telemedicine which came in post the
mm,
pandemic. So we moved our consultations and specialist meetings and all of that via online and via Zoom. And most some elders are actually quite okay with it, even engaging
mm,
with their own families. So we make sure that
mm,
they FaceTime their families
mm.
once in a while. They're able
Okay.
to communicate with them. So
Mm,
yeah, I mean, technology is going to play a very important part in how we scale up and
mm,
grow, because
mm,
without efficiency, it's certainly going to be difficult.
mm. And how much changes have you seen in the last 10 years, like you've been here?
I think a lot, because
Mm,
2012, the elder care industry in India was, missing. I mean, it was absolute. It was not even there in that sense. There were very few players interested in this segment because it's always viewed as a social segment, and the reason, and because it did not people were not willing to invest in it, and create meaningful capital was not available for this. You also did not find quality people, people who were willing to make a career in elder care. And
Yeah,
that is one
exactly.
of the biggest changes that I've seen, and I've been a very big advocate for. Because without
Mm,
people, elder care is one industry where you cannot
mm.
do without good people.
Yeah. Mm.
So the last decade, apart, I would say last decade was one story, and the last 2 years was one story. So
Okay.
post pandemic, the focus on the elderly has been immense,
Okay.
immense, because people have understood that leaving their parents alone in their homes is
Mm,
a very very it needs to be thought. So aging
mm,
was a very normalized thing. Yeah, everyone ages. There are age
mm,
related challenges. What is the big deal? That
mm,
elder care and geriatrics is a specialized segment is something
mm.
which now in India you can see that people are understanding, and that's the reason why now I think there are more than 100 players, 100 good players across the
Okay.
country that you see. And whether this is aging in place, which is home care solutions,
Mm,
technology or product solutions, and
mm,
residential care solutions. So
mm,
that shift has been, I think it's the sunrise, still the sunrise industry,
mm,
but it's definitely going to change. I mean, the next decade, I think we're going to be,
mm.
flooded with options.
And how does India, our country, compare with the more developed nations like maybe US or Europe?
Yeah.
So
So I
how
think
is?
India is a different story.
Mm,
And I sometimes club it with Asia also because it's the mindset. So
mm,
culturally, it's never going to be like a US or Europe story, to be honest,
mm,
because we believe in taking care of our elders. Culturally, everyone knows that it is my responsibility. Whether it is the responsibility of finding a good home and then making sure I still visit the home, or I
mm,
find care in my home, whatever it is still the family's responsibility, right?
mm,
But
mm,
so India is at a crossroads right now where we are becoming very, nuclear families,
mm,
women in the workforce, people becoming busier, longevity. It's not very difficult to see a 90-year-old right now, better healthcare, and
mm,
so on. So we are at a crossroads where we are becoming a developed nation, but our roots are intact. So we have to find a solution which kind of takes into account both the settings. So you can't expect that today everyone thinks that yes, my normal retirement solution is a retirement community. So I don't
mm,
think we are there yet. But given the staggering number of elders that we're going to have by 2050, which is more than 20% of our population is going to be elderly. So there has to be this change that whether we like it or not, the industry has to grow up and quickly. The government has to step in. And the good part right now is that the industry is not regulated. So there's a lot of scope for innovation to happen. Barriers to this market is very limited. So it's
mm,
good. It's good because it will encourage more and more people to come in and give solutions across the country.
mm. You talked about government. What are your expectations from the government?
I think to not interfere a lot, because like I said, the moment you put too many barriers, people will not be able to come in and create those solutions. So I think it should be directive and not become a very regulated environment like probably the US is. But there should be some hygiene, of course, regulations which need to be in place so that the quality of care and services, there is some check mark to it. So whether it is encouraging self regulated bodies, so I'm
Mm,
part of this industry body called ASLI, which is the Association of Senior Living. I'm on the board as well. So it's a
okay.
great body work, great industry body where we're trying to act as an advocacy body to kind of advise the government on what is really required, and
Mm,
across sections of society, what is needed in an urban setting, what's required in a rural setting, because
mm.
one policy will not fit everywhere.
All.
And I think
Mm,
second thing is to encourage private partnerships. That's
mm,
important. Private
mm,
players, because public, there's very little right now work done in the public segment, but the government is open to listening to us. I think they're very very, the Ministry of Social Justice has been very open in
okay.
listening to us, so encouraging private players to come
Mm,
in a healthy open environment with the
mm,
right checks. consequences. I would say that.
Okay. Now we come to say not everybody can afford an Epoch Elder Living Care home.
Hmm.
So, what advice or maybe tips would you want to give to people who have maybe dementia patients at their homes or other kinds of disabilities with elders who are taking care of? What kind of advice would you give to them?
Yeah.
What are the basic things at least that these should be done?
Absolutely. And I think the moving into an epoch home or any care home is always going to be a smaller part of the story, right? Aging in place or staying in your own home is actually one of the very important India story, which is going to be the case, like I explained why. So, I think only one line I would like to say, and that kind of captures everything, is that let's not normalize aging and age related issues. Okay, so what that means is that there's a reason why there is a field of study, for this particular profile of the population. So, like pediatricians, for children, why? Because children needs are different. A general physician who looks after you and me cannot treat a child. It's the same for the elderly. So geriatrics is a science, and we must understand that if there are changes in the body, in the mind, in personality, in mood, it's not that ye hoga and there's nothing to be done about it. So when your parent starts, the moment your parent retires, and 60, today 60-year-old is very young, so it's not that question. But the moment the person has been the breadwinner, has been the decision maker, but retires, that itself, kind of makes a switch in their mind. And it's a phase where they adjust to that. Okay, now I'm not the decision maker in the house. And that's why, for women, it's longevity and aging has been a sort of an easier journey, especially women who have always, managed homes, etc., because for them that shift doesn't happen at 60. Right. So I think it's important for children to recognize that when my parent is becoming 60, 70, 80, we will have to make changes in our own approach, behavior, communication, spending time, and encourage them, and not expect realign my expectation with my parents. So why is my father not able to independently go and, pehle to he used to fill the bill and keep track of everything? Why is he not able to do that? There's
Yeah.
a reason. So getting them access to whatever they need. So if someone has disability, like you mentioned, whether it is dementia or any other such condition, it needs training. It needs a trained caregiver. So if you are at home and you are going to be the caregiver, so read up about it. There are many aspects. There are many avenues to upskill yourself, to understand what dementia is. Epoch also does a lot of awareness work, counseling, and so on. Many other organizations. So read up, make, empower and equip yourself to be the caregiver, or if you're or hire a caregiver, because caregiver burnout is a very real thing. So if you're going to burn out, then you're not able to, kind of give the quality of care for your parents. So, hire trained people. Make sure that you have the bandwidth mentally to be able to always be in that positive mood, because it's a tough journey. Or seek help and advice, but don't normalize it, thinking that apne aap hi, things will be fine.
You talked about counseling and all. Epoch is doing a lot of counseling. You said, do you hold? Do you give this counseling to people who call you up, or on your own? Do you hold workshops or maybe seminars or webinars? Do you do that sort of thing?
Yes, yes, absolutely. So, community building awareness and community outreach is something that we absolutely believe in. So, like September is the Dementia Month, and every year we make sure that we are able to go and speak at forums. Anyone who invites us, we are very happy to. We have a lot of in-house expertise. Our facility managers and nurses who have on-ground experience. Over the last
Okay.
couple of years, our clinical head Prasita, she has been with us for the last 8 years. So she is, absolutely a great person to learn these things from. So we are available for online awareness sessions, offline, if we want to hold a workshop in RWAs. So this is the
Okay.
community outreach part. But for a more personalized consultation, so we also do teleconsult and in-person consults.
Okay.
We call it the dementia family consults, where
Mm.
families can essentially book a session with one of our specialists, and
Mm.
we advise them, over a couple of sessions on what or how they can handle their parent in the home.
Mm.
Yeah.
And what sort of future do you see? You've spoken a little about it, but I want you to expand it
For
a little.
Epoch,
What sort of, for Epoch as well as for elder care in India,
yeah.
both the things. Mm.
For elder care in India, I think this is the industry to be part of right now, because of two things. One, the need is there; it's staring
Mm.
at our faces. The
Mm.
numbers are huge, and there are only a handful of people available to kind of cater to the need of people. So
Mm.
there are
Mm.
110 million, or maybe I think it's
Mm.
140 million elders who are right now in
Mm.
India, which is a huge number, right?
Mm.
So I think this is the industry which is not only gratifying.
Mm.
There is a sense of goodness to it. There's a lot of blessings, a lot of smiles, gratification, all of that, and at the same time, it's a wonderful opportunity to build your career in, because few people are specialized in this field. So this
Yeah.
is the time to kind of to get trained in it, practice in it, and make your sort of services available. So in as a career, as an industry, I think this is one of the next upcoming industries, like in healthcare as well.
Okay.
In Epoch, the plan is really to scale up very quickly over the next 2 to 3 years. So we want to open 10 to 20 homes, focusing on the north
Okay.
and the west region,
Okay.
and we have four
North and
verticals: north and
North and
west.
West. Okay.
Yeah. So we
Okay.
want to build
Mm.
that presence right now. And
Mm.
we have four verticals right now. So assisted
Mm.
living, dementia
Mm.
care, recovery and rehab, and palliative care. So we
Mm.
want to, kind of deepen our offerings in this field.
Mm.
Do a lot of, also dementia. So in dementia also we are opening daycare centers, and family consultation, caregiver consultation. So do a lot of other, non-residential work for elders who
Mm.
want to continue staying in their homes, but how can Epoch sort of support them? And yeah, I
Mm.
mean, I think it's a small home, slow and steady growth story over the next 2 and 3 years.
Okay. So how many more homes do we expect, say, next year?
So we plan to open about 8 homes over the next 1 year, across
Okay.
north and west. Yeah.
Okay. That's remarkable.
Well, that's the need
The
I see right now.
yeah, yeah. Okay. So thank you so much, Neha, for talking to us.
Thank
And
you
we're
so
very
much.
happy. Yeah, we're very happy that you are doing this kind of work because in my like friend circle, I have seen elderly, like their parents with dementia, and they stayed at homes, and the situation was not. Matlab, I would meet them, and I would go into depression. Frankly telling you, and we didn't know what to do. Even my now they are no more, but my friends, they didn't know what to do with them, how to handle. So that was a big psychological thing, very
Yeah.
depressing. So I'm glad that people like you are there who are rising to this need, and I wish you all the best, and do well, and do well for others and for yourself. Thank you so
Thank you
much.
so much. That's very sweet of you. And in the future, now you know about us, personally also, any help anyone needs, we'll be very happy to
Yeah,
help.
yeah, sure, sure. I will definitely.
Keep us in
Yeah,
mind.
yeah. Thank
All
you.
right. Thank you.
Thank you. Bye bye.
Bye.